layer on top of that the fact that dosing THC and CBD can be fairly straightforward in the form of edibles, right? Because there can be, at least if it's a controlled source, a defined number of milligrams of THC, a defined number of milligrams of CBD. That's true for ingestibles. It's much harder to gauge that from the smokable forms of cannabis, especially if those smokable forms of cannabis are obtained through sources where there isn't a lot of clear information about the total amount of THC in that product. Now, this is all changing quite a lot nowadays because of the commercialization of THC and CBD products and cannabis in a number of different areas, including in the United States. But still, many people are ingesting cannabis, THC, CBD through sources where they don't really know how much they're bringing into their system. And so whether or not someone gets incredible anxiety relief, enhanced sense of mood and focus and well-being, pain relief, et cetera, or whether or not they have full-blown panic attacks, et cetera, is very hard to predict based on dosage information alone. Now, of course, we can create broad categories, and we're going to talk about studies that create broad categories of low dose, moderate dose, and high dose, frequent use and infrequent use. But unlike alcohol, unlike nicotine, we can't really point to specificity of X amount of alcohol, grams of alcohol per week, which is safe, or X amount of alcohol, which is not safe.